Hello everyone, I'm Dr.Alekya, Singapore's dermatologist, and in this video I'll be sharing with you all the importance of skin hydration and how do you know if you have a dry skin or a dehydrated skin and what's the difference between both of them. So when I say when I ask a patient if you have what's your skin type, the first thing they'll say is the skin type that's on their face, oily, combination or anything. The skin type on the face can be totally different from your skin type on the body because the skin structure on your face is different and the skin structure on your body is different. So when I say what's the skin type of your body, you cannot say it's oily just because your face skin type is oily. That's the first thing that you have to remember. Now when I say dry skin, it doesn't always mean that you need to have a dry, the first thing that comes into our minds is dry flaky skin or itchy and irritated skin, fissured palms, cracked feet, flaky skin coming from the dorsum of your hands or dorsum of your legs. So that's not that is definitely a dry skin, but it's actually like a spectrum. These symptoms which you see, this dryness, flakiness or powdery skin, or you see those skin feeling tight during the winters, all those things are the extreme end of your dry skin. That is like a super dehydrated and a dry skin. And it can also be sometimes, dehydrated skin can also be sometimes as simple as having a dull looking skin, as lusterless skin, or most of them say, I do everything but somehow my skin looks pigmented. It looks dull or it's just darker, like my body skin is better and my face skin is darker. That's because even if it looks normal, it is dehydrated. You need to understand the difference between a dehydrated skin and an improperly hydrated skin. Dehydrated skin is definitely your dry skin that is extremely, seeing all the symptoms which I told you. Improperly hydrated skin may not be feeling as dry or may not be having all those, showing all those symptoms, but definitely you will look duller, you will look dull or you look pigmented or you look little darker than what your body skin is, or maybe your just skin is looking little lusterless, dull, like most of them say, doctor wo glow chahiye mujhe, wo glow nahi hai mere skin mein. So that is your improperly hydrated skin. So that's the difference between extremely dry skin and also your improperly hydrated skin. So my point is, even if your skin looks normal, it may not be normal or it may not be hydrated. When you just try to give a blunt strike on your skin, if you look at it, some people will have those white lines forming on the skin. That is an improperly hydrated skin. But the rest of the body is fine. They do not have those flakes. They don't have any kind of irritation, itching on the skin. But when I try to do that test in the OPD, you can just see those white lines. So that means your skin is improperly hydrated. Now why is this hydrating your skin is so important? Is because the main function of your skin is barrier protection, which means your skin will form a barrier between the external environment and the inside of your body. And when your skin barrier protection is good, or if you can maintain a barrier, your strong barrier, that's when nothing from outside will enter into your body. And if this happens, and in an improperly hydrated skin or in an extremely dehydrated skin, there are high chances that anything externally can actually irritate your skin. Any allergens can actually cause irritation on your skin because the skin is not properly hydrated and it is not able to do its proper defense mechanism. Now we have understood what's the difference between a dry skin and an improperly hydrated skin and a dehydrated skin, and also we understood what is the skin barrier protection and why is it important. The next thing I want you all to understand is dryness or a dehydrated skin is the causative factor for many issues on your skin. You just start having those red rashes on the body. You also have itchy skin suddenly. You also have that itchy skin on the sides of your nose. You will have cracked corners of your lip. Like your lips are hydrated, but your corners of your lips are cracked, and you have those fissured palms or those dry palms, and your skin is peeling off from there, and your cracked feet. All these things, the causative factor for all these, most of the conditions in the skin is basic, simple, dehydrated skin. When I say your skin is dehydrated, they say, oh no, that's not possible because I drink lots of water every day. That's good, you drink lots of water every day, but research says that no matter how much water you drink or you're trying to hydrate yourself, only a very little percentage of it is getting absorbed into your skin. Now, very important point for us to remember is when you have a skin condition like dry scalp, flaking scalp, dry skin, or you have those irritated skin or rosacea or those red patches on your cheeks, fissured palms or dry palms, dry skin peeling off or cracked feet, all these things are skin conditions. In that condition, it is very important for you all to visit a certified dermatologist, because we dermatologists deal with every issue that happens to skin, nails and hair. Even if it is as simple as your skin peeling off from your tip tip of your fingers that is again dealt by us. So when you have any skin condition, it is important that you visit the expert in that field. I usually tell my patients, if you like, I hear many of them saying, doctor, I'm trying to dip my fingers in the salt water, in warm water, try to do everything I can, but still somehow my skin looks dull, feels dull, just peels off. Now it's fine if you all want to follow your own remedies, that's your choice. But when you have an active skin condition going on, when you're having all these symptoms on your skin, it's better you visit a dermatologist, get your skin condition treated, get rid of the problem. Once the problem is solved, once the issue is resolved, that's when you can switch back to your maintenance. Like you want to do something, you want to apply something, that's all in the maintenance phase. But when you have an active skin condition, it's important that you visit a certified dermatologist to get rid of the skin condition. Now, as you've understood the dryness part of it, the dry skin, dehydrated skin, the different types of skin types on your face and body, let's see how to make sure that you don't end up in a dehydrated skin. At the same time, even if you have a dry skin, how are you going to correct it? The first and most important thing, which we all know and which I always insist, is to have oral hydration, a proper oral hydration, that is by drinking water every day. In spite of us understanding the importance of water, somehow we end up not reaching up to the limit that is required per day because of a regular lifestyle. So make sure that you drink enough amount of water every day, 6 to 7 glasses of water every day. If you're working out, drink some more. If you're a person who sweats a lot, you need to drink more. If you're a person who smokes a lot, then you need to drink more water. So there are special conditions where you need to drink more water, but make sure that you drink enough amount of water, required amount of water for your body every day. That will give your oral hydration. The next important thing is topical hydration. That is applying a good moisturizing lotion or cream on your body. If you have a normal skin, make sure you apply at least once daily a nice lotion on your body. Again, while choosing your products, make sure that you apply your moisturizing lotion or cream on your body according to your body skin type, and for the face according to the face skin type. So if you're having a normal skin type, I usually say once application is fine, provided you're using a good moisturizing soaps or body washes. If you're having a dehydrated skin or improperly hydrated skin, I recommend at least twice application, once in the morning, once in the night, over a damp skin in the morning especially, because damp skin will help in entrapping the moisture content for longer hours. And if you're having a dry skin, like an extreme part of it, like proper dry skin, that's when it's important that you apply multiple coats of moisturizer during the day. Morning and night is mandatory. If you can apply once or twice in between, also at least on the exposed parts where you can apply, like on your hands or on your legs, it will be even more better for you to have a good hydrated skin. So these two are the basic things that you're supposed to do. So once you get your skin condition treated, if you have any, and then you switch to this maintenance, that's going to help you all really good. I hope this video is going to help you all understand your skin more better and the importance of a hydrated skin. Stay tuned for my next video, in which I'll be sharing with you all on how to pick up a good moisturizer for your skin on the face and also skin on the body, and what are the ingredients you need to look for. Do not forget to share this video with your friends and family, and stay tuned.